Alright, how's it going, everybody? Today we'll be going over chapter 19 of the Corpsman Manual. This is the laboratory section. I am a lab tech by trade, so stuff I'm going to highlight today is going to be stuff that I've seen on the exam, or I think it potentially can be in the exam. So I know it's a long chapter, so just try to follow along. If you guys have questions after this, you can feel free to email me. I can try to explain things a little bit further, but without further ado, let's begin. Some of the highlights is stuff from other sources as well. So this is a big one. I've seen this one on exam before. SF 545 laboratory report display. I've seen that actually probably like twice in the exam, so I would remember that. I would highlight that. Yeah, just remember SF 545 laboratory report display. Again, this is from other sources. They have some other stuff highlighted that sometimes I don't agree too much with, but yeah, it just seems like a lot of verbiage so far. Again, this showed you a picture of the laboratory report display, which is the SF 545. Okay, let's keep going. Okay, I've seen this one on exam. I would highlight that. There are two principal methods of obtaining blood specimens: the capillary method and a venipuncture method. So yes, the most common and the one that's preferred is venous blood. Again, capillary is usually done like for like a finger poke. So the most common one is through the veins. Let's see. Okay, so this is pretty important. I've seen this one a couple times. So I would highlight universal bloodborne pathogen precautions. So this is outlined by OSHA, which is Occupational Safety and Health Administration. What this means is all human blood and certain other human body fluid are treated as if known to be infectious. So I would remember that. So if you guys worked in the lab before, done any kind of blood draws with your corpsman, you should use a 2x2 to cover any blood extraction. Okay, moving along. Okay, so I've seen this one on test. So the way we do heel sticks is usually it's for your pediatrics. We usually do it through the heel. That's how we get the capillary blood. I would highlight that. %. So this is where you cleanse the site with either 70% isopropyl alcohol or iodine. I would highlight those as well. Oh, definitely highlight this. I've seen this multiple times as well. Using the middle finger or ring finger. So they'll ask you, what finger would you use to obtain a capillary specimen? So you will be using the middle or ring finger. Of course, you warm the site to make collection easier and faster. So I would definitely highlight that. Always puncture away from the midline. There's another question that I remember that's on here. Yep, I would highlight that. Take a lancet and make a quick stab no greater than 2 millimeters deep on the side of the finger, off center, right there. Where would you make the finger poke? It's gonna be off center. So show the picture of the finger, and then it's off center, which is right to the side of it. So that's how they would say it. So the answer would be off center. Oh, yep. So when you do a finger poke, if anyone have ever done that before, you want to wipe away the first drop of the blood, just because you want to try to milk it to get that's just gonna be just fluid coming out at first for the most part, and then the most reliable blood is after your first or second drop. Yeah, it says it right here with excess tissue fluid. Okay, definitely highlight this one. This one's I've seen it in an exam as well. Collect blood in the correct specimen container by scooping blood one drop at a time. It's gonna be asking you how do you collect the capillary blood, and you collect it by scooping method. Again, use the heel for newborns. I would highlight this right here. No, do not draw blood from an arm with IV fluid, of course, because you dilute it and it's not a valid specimen. Of course, if you ever walked in the lab, you never perform a venipuncture while they're standing up. All right. So the procedure, how to do it, I've seen this on the exam multiple times. Apply tourniquet around the arm approximately 3 to 4 inches. 3 to 4 inches, remember that, 3 to 4 inches above the intended venipuncture site. I remember, so 3 to 4 inches, tourniquet. And then when you find the site, you want to anchor it with your thumb and placing. I really haven't seen this one. I mean, I don't know if you guys have, but I don't think I've seen that one. But the question would be, at what angle do you draw venous blood from? It's gonna be 15 and 15 to 30 degrees usually. So I like that. Oh, yep, I'm going back to it. And it has to be bevel up. Bevel up. Alright, let's keep going. Definitely seen that one. Do not leave the tourniquet on for more than 1 minute. More than 1 minute, you gotta take that tourniquet off. Again, this can vary. This is just for test purposes. Okay, so test purposes, do not leave the tourniquet on for more than 1 minute. This, I've definitely seen this one on exam. A lavender top is often used for complete blood counts. This is for your hematology section. Complete blood counts. And later we'll get into what is in a complete blood count. A red top is often used for blood chemistry. I've also seen that one on the exam. Okay, and just familiarize yourselves with this chart right here. Every coma should really know the order of draw, so just know the color and know what it's used for. No easy way of doing it, just repetition. Oh, so now we're going to the microscope. Oh, the microscope. How much I love this thing. All right. Most laboratories are equipped with binocular 2-eyepiece microscopes. I would highlight that. You guys ever get a chance, just walk in a lab and see how this thing works. It'll help you memorize it more. Okay, so I've definitely seen this one. What is the most often used microscope in the laboratory? This is the compound microscope. Compound microscope. Definitely seen on the exams. All right, and then the framework. You gotta know these. These are definitely asked in the exam. So for the arm is a structure that supports the magnification and focusing system. The stage is the platform on which a specimen is placed for examination. Mechanical movable stage holds a specimen in place and is means by which the specimen may be moved about on the stage to view the sample. So this is mechanical stage right here, the arm, and you got the stage. Okay, the base is structure on which the microscope sets. This is the base. Illumination system, definitely know this as well. I've definitely seen exams on this. Internal light source. So the internal light source right here is located on the base of the microscope, providing a precise and steady source of light in the microscope. Boom. So this light comes up so you can see the actual specimen on the slide. Condenser is composed of a compact lens system and is located below the stage. It concentrates and focuses light from the light sources on the specimen. Condenser right here. Iris diaphragm is located on the condenser to control the amount of light and angle of light rays that will pass to the specimen and lens. So yeah, I would just familiarize yourself with these. Damn, I can't talk today apparently. It's objective lens. Definitely know this. It's responsible for the magnification and resolution of detail in a specimen. So, yep, so most common in the laboratory, we do use 3. So on a compound microscope, there is usually a set of 3 objective lenses or objective, I don't know why it's, okay. So a set of objective normally consists of a low power. So remember, low power is approximately a magnification of 10. So on the actual object, it actually says low power and usually says 10%. A high power is 40%. So remember that, high power 40, low power 10. An oil immersion, so we use this to sometimes look at well, not something, but we use it to look at like red blood cells, white blood cells, bacteria, and so we end up using the oil and putting a drop on the slide of oil to magnify that object. Sorry. So yeah, 3 most common: 10, 40, and 100. I don't think I've seen this. Body tube I've seen is a tube that permits light to travel from the objective to the ocular lens. Ocular lenses or eyepiece are located on the top of the body tube and usually have a magnification power of 10. So this is separate from the other 3 magnifications, the most common ones. So if this is 10 and you're using the low powered, what do you think that'll be? That'll be 100. So if the ocular lens you're using it's 10 and you're using the high power magnification, that'll be 400. And same thing as for oil immersion. So if the ocular lens times the oil immersion, which is 100, is going to be 1000 magnification. So don't mix that up. I've seen that plenty of times in an exam. I've seen this as well. Focusing is accomplished by moving the stage up or down with the coarse and fine control knobs. So if you come back up here, this is how we adjust it: coarse and fine control. The coarse is get yourself in a general area. The fine is when you're in that area where you want to see. It's where you finally just kind of adjust it a little bit so you can get that good vision. So again, coarse control knob is a larger inner knob. Rotating the coarse control knob allows the image to appear in approximate focus. And the fine control knob is a smaller outer knob. Rotating this knob renders the imaging clear and well defined. Again, coarse, bigger, fine, little. I've seen this on the exam. Using the coarse adjustment knob, the body tube will be lowered until the face of the objective is within 1/4 inch of the objective. Mhm. I've seen this one in exam. I would highlight that. If the specimen is too dark, what would you do? You would increase the lighting by opening the iris diaphragm. Again, what I was talking about before, the oil immersion objective 100 times is used for detailed study of stained blood and bacterial smears. So again, stating just the final steps in focusing is done with the fine adjustment knob. Of course, the course is trying to get yourself in the general area, and the final step is with the fine adjustment knob. I've seen this out on an exam actually. Lenses may be wiped carefully with lens tissue. You remove the oil with lens tissue. I've seen that. You don't use alcohol to clean the lenses, since alcohol would damage the lens assembly. We all know. I won't go into that. Never mind. All right. So complete blood count. So these are the 5 things that go into a complete blood count: your total red blood cells, your hemoglobin, your hematocrit, your total white blood cells, and white blood cell differential. So I would just highlight the key things, so you don't have to know all this verbiage. Just red blood cells, you got your hemoglobin, your hematocrit, your white blood cells, and your white blood cell differential. So the difference between the white blood cell is your whole white blood cell count, but differential goes into how much of each white blood cell you have, and we'll go more into that here in a bit. I've definitely seen these two statements on the exam. A red cell count that drops below normal values may indicate anemia. I would highlight that. And then also, a red cell count that rises above the normal values may indicate dehydration. So when red cells are low, it can be considered anemia. When red cell count rises, it is considered dehydration. Just remember that. Definitely seen that on the exam. So the primary function of hemoglobin is delivery and release of oxygen to the tissues and facilitation of carbon dioxide excretion. So hemoglobin, delivery and release of oxygen. I haven't seen this one, but I mean, it's good to note down. You never know. So just before we go into what we're going to be talking about next, just remember values are affected by the age, sex, disease, and altitude. So they're definitely going to be giving you women and men's values. So we'll go into those. So the normal values for hemoglobin determinations are women 12 to 16 and men 4 to 18. The way I remember this is it counts by 2. So if you know 12, 14, 16, 18, right? Even numbers, then you know, okay, the lowest one is 12, and skip 2 numbers and it's 16, right? Well, skip 2 even numbers. Anyways, 12 to 16. And so if you know 12, 14, 16, 18, then you know between 12 and 16 is 14, and then the one above 16 is 18. That's how I remember it. Yeah, that's just the way I remember it. All right, next one is the hematocrit, or packed red blood cell volume, is the ratio of volume, the volume of RBCs to the volume of whole blood. I would definitely highlight that. And so now the normal values of hematocrit. So for women, there's 37 to 47, and men is 42 to 52. So the way I remember this, again, so 37, 47, same number, the same last numbers on the low and top range. And same thing for men. It's the second number is a 40. It's a 42 to 52. And each one, if you notice, it's 10 numbers apart. So that's the way I remember it. So they're 10 numbers apart for each one. Automated hematology analyzers. Yeah, I mean, we don't do manual things anymore unless for some reason something goes down and if you're like in a deployed setting or something. But everything's automated. So now it's the automated hematology analyzers currently supply most hematocrits, which they supply basically all the 5 components that make up a complete blood count. So that's kind of no-brainer. And I actually do believe I've seen that one on the test though. So the total white blood cell count, I would highlight that. The total white cell, which is leukocytes. Leukocytes, another way of saying white cell, or just white blood cells, right? It counts in terms of the number of white cells per cubic millimeter of blood. I do believe I've seen that on the test. It's the unit measurement per cubic millimeter of blood. Normal white blood cell values, definitely remember this. White blood cell values in adult range from 4,800 to 10,800 cells per cubic millimeter. So again, either 4.8, 10.8. Yeah, I would highlight that. Excuse me. Oh, definitely. So abnormal white cell counts. When the white blood cells, also known as leukocytes, right? Leukocytes rises above normal values, the condition is referred to as leukocytosis. So leukocytes above normal value, leukocytosis, right? And yep, it is going to talk about leukopenia. Cool. And so this would be in severe medical conditions, white cell counts will exceed 50,000. So remember that. I would highlight that. So other physiological condition that can cause leukocytosis, which is an increase of or a rise in your white blood cells, is shortly after birth. I would just know all of these honestly, but shortly after birth, pregnancy, appendicitis, ulcers, emotional stress, anxiety, strenuous exercise. I can go into more detail, but in this case, I just want you guys to know, just remember that. So an abnormal low white blood cell count is known as leukopenia. Anemia, remember? Just like anemia, it's going to be something low. You're going to have low. So leukopenia, just remember that. And may be caused by the following conditions. Severe advanced bacterial infections such as typhoid, paratyphoid, and sometimes tularemia. When a bacterial infection has been undetected for a period of time. Protozoal infections such as malaria. Helmintic infections such as trichinosis. I think I've seen this one more on the test than I think any one of these. So they're gonna ask you, well, what would your white blood cells be if you had anaphylactic shock? And so the answer to that, it's right here, leukopenia. You have low white blood cells. All right. So I would remember this. Your 5 types of white blood cells are normally found in the circulating blood. Well, yeah. They are your neutrophils, your eosinophils, your basophils, your lymphocytes, and your monocytes. I will highlight that. And just remember, these are not in order. So we will discuss which ones have more, because they will ask you what white blood cells are higher than other white blood cells, and also depending on the infection. So just memorize yourself with those. Morphology, the study of form and structure of organisms. It's morphology. I would remember that. Okay, alright, this one's been on the exam. So why would we do a blood smear? So to get a differential white cell count, we would do a blood smear. Definitely on the exam. So neutrophils accounts for the largest percentage of leukocytes found in a normal blood sample. This is the largest percent of leukocytes. It's not the largest white blood cell, right? It's the one there's more of. And I would remember what they do. So in this case, neutrophils function by ingesting invading bacteria. I would know their morphology. So the morphology, basically how they look under a microscope. So they have visible lilac colored granules and a dark purple or reddish purple nucleus. I've seen this one on exam. So they sometimes will look, the nucleus may be oval or horseshoe and S-shaped or segmented. Segmented meaning this one's kind of segmented, so I mean it looks like it's separated. That's really kind of all it means. So it's like 1, 2, 3. There's 3 segments. Same like this one, 1, 2, 3. 3 segments, and so S-shaped can be more like kind of like this, but it will look like a S in there. But just remember that. Neutrophils bands, sometimes called stab cell, is an older or intermediate neutrophil. Band. Segmented neutrophil is a mature neutrophil. So a segmented neutrophil is a mature neutrophil. Yeah, I would just highlight that. That's good to know. Alright, eosinophils. So the function of eosinophil is to destroy parasites and respond in immediate allergic reactions. Definitely highlight that. So the cytoplasm of an eosinophil contains numerous large reddish orange granules. I don't like this picture, honestly, but they're very distinct. If I'd show anyone, they would be able to point out an eosinophil. That's probably one of the easiest cells probably to identify, in my experience. So again, the most common cause of increased eosinophils worldwide is a parasitic, in particular, I can't pronounce that. Helminthic infections. Anyways, just know it's they increase when there's an immediate reaction or it's a parasitic infection. Basophils. Alright, so a rise in basophils is associated with inflammatory disorders and certain leukemias. Yeah, I don't think I've actually seen the actual how this one, the morphology actually is. So just remember that. A rise in basophils is associated with inflammatory disorders and certain leukemias. Lymphocyte. So the function is associated with immune response and the body's defense against viral infection. So lymphocytes. So for example, mono. If someone has mono, I know it sounds like it sounds like monocytes will be involved, but it's actually a viral infection. So you'll have a lot of lymphocytes popping up on your results. So just remember viral lymphocytes. I've seen this one before, the morphology of it. So lymphocyte is clear sky blue. Again, these pictures kind of suck, but it's clear sky blue, scanty with few unevenly distributed blue granules with a halo around it. Yeah. Alright. So the monocyte. Alright, this is why I want you to don't get confused, because there's monocyte and there's the neutrophil, right? So the monocyte is the largest of the normal white blood cells. Neutrophils are the ones that have the most percentage. So monocyte, the largest of the normal white blood cells, controls microbial and fungal infections. Remember that. So this one's microbial and fungal infections. And remove damaged cells from the body. Okay. Remember that. The morphology of it is it has an indented nucleus and an abundant pale bluish gray cytoplasm. Alright. Go into bacteriology. So let's see. Okay, I would highlight that. So the disease-producing ability of bacteria is either referred to as pathogenic or non-pathogenic, and know the definition of both of those. Pathogens are bacteria that causes disease, and non-pathogens are harmless bacteria. So definitely know that. So yeah, for example, you in the throat or in the mouth you have a lot of bacteria, but there's some that are actually pathogenic that will give you stuff like strep throat or yeah. I don't think you gotta know that. Alright, big one. I've definitely seen this on the exam. Sorry, I had to get a drink of water. Alright, so the 4 growth requirements for a bacteria are 1. Temperature, 2. Oxygen, 3. Nutrition, and 4. Moisture. Remember those. There's 4 of them. And then the temperature requirements, so it goes into the, other criteria into each category. So temperature requirements are divided into the following 3 categories. Psychrophilic, cold-loving bacteria that reproduce best at low temperatures. The way I remember this is honestly, I think of like psycho. No, I had a highlighter on. Nice. I think of psycho as in like you're a psycho for going outside in the cold or living out in the cold. That's just me though. Mesophilic bacteria that reproduce best at body temperature and are the primary pathogens in man. Mesophilic, I just think of like middle. It's in between low and high. So that's the way I remember mesophilic. So this is body temperature. And then thermophilic, bacteria that reproduce best at higher temperatures. Thermophilic, therm, that's just, I think of high. It's the only way to think about it. I mean, if you guys have other ways, that's great, but just, I would definitely remember those. All right, so oxygen requirements. It can either be aerobic or anaerobic. Aerobes are organisms that reproduce in the presence of oxygen. Aerobes. So without. Anaerobes are organisms that do not reproduce in the presence of oxygen. I would definitely remember those. Always asked. Nutrition requirements. No. Moisture. I haven't really seen anything on those. All right. Morphologic characteristics. All right. So, morphologic characteristics. So it is based on 3 distinct shapes or categories. So coccus, so it's spherical. I just think of coccus, starts with a C, circle, spherical, appears singly in pairs and chains, clusters, or packets. You do gotta remember what they appear with. So they appear in pairs, chains, or clusters. PCC. I don't know. I just came up with that. Bacillus. So bacillus are rod-shaped, appear singly in chains or in different organization, railroad tracks, or school of fish. Oh, I've seen that one. Railroad tracks or school of fish. This bacillus. Rod-shaped. They're almost like an oval kind of too, but bacillus. Definitely know that. Spirochetes. They're helical, spiral, corkscrew shaped, appearing singly only. I would Definitely remember that as well. I definitely seen that on the test. So toxins. Toxins are divided into two categories. I'll remember both of these as well. So endotoxin comprises part of the cell wall and is released as the bacterial cell is destroyed. Endotoxins are less potent than endotoxins. So exotoxin produced by bacteria and found outside the bacterial cell in the surrounding medium. Exotoxins are highly poisonous and associated with septic shock. So I just remember endo in, exo out. Exit in, exit in. Cool. A gram stain, it can detect bacteria in patient specimens and is critically in identifying culture bacteria. I mean, yeah. Like bring the swab over, we culture that on these petri dishes that have some kind of animal blood, and it grows different bacteria. Just giving you a little background on that. So a stain can be either gram-positive or gram-negative bacteria. We'll get into that. Oh, right here. So gram-positive cells retain the primary crystal violet stain during decolorization and retain the violet stain. Gram-negatives do not, though, and are counter-stained pink. So gram-positive, crystal violet, they look purple. Gram-negative, they look pink. So here's a good little chart where it kind of breaks it down. So cocci, which is a spherical bacteria, and it goes into gram-positive or gram-negative. So gram-positive means it's stained purple. Gram-negative, it's stained pink. So a spherical purple bacteria can indicate these different infections or organisms. So I would remember those and the type of infection that you'll see it with. So Streptococcus pneumoniae, it's in the word pneumonia, right? Streptococcus group A, strep throat. These are the most common ones I saw. All right, so spherical gram-negative, which is pink in color, you'll see Neisseria gonorrhea, and Neisseria meningitis, which is meningitis. Kind of, no brainer there, right? So bacilli, so they are, I don't want to use the wrong verbiage. So rod-shaped appear singly in chains. Okay. Rod-shaped and gram-positive, which is they look purple. The genus and species that it most likely can be Corynebacterium diphtheria. I can't even pronounce that. Diphtheria. No brainer, it's in the name. A lot of times the genus and species, the type of infection is actually in the name. I would just remember all this, to be honest, because this kind of goes hand in hand with also your what is it called, the bacteriological agents, and so it can help you kind of remember those as well. So rod-shaped, gram-negative, which is pink. The most common one I've seen is the Yersinia pestis one, which is bubonic plague. Just memorize that whole chart. Hopefully, I just want to give you guys a little background on it. Smears. So gram-positive organisms are easy to see because they stain a deep blue or blue-black. It says, for test purposes, remember, deep blue or blue-black. I know I say purple. I think it also can look purple, but just deep blue or blue-black. Deep blue, blue-black. Gram-negative organisms stain a deep pink, but since the background material is also pink. Minute and detailed inspection is necessary before reporting the results. Yeah, so remember the colors on these. Again, deep blue or blue black. Forget what I said on purple. Test purposes, deep blue or blue black. In the presence of gonorrhea caused by Neisseria gonorrhea, the smell will reveal varying intracellular and extra gram-negative bean-shaped cocci in pairs, diplococci. I've seen that one on the test a lot. Caused by Neisseria gonorrhea, the bacteria will look bean-shaped cocci in pairs, so it'll be diplococci. Serology. All right. Serology consists of procedures by which antigens and reactant serum globulin antibodies may be measured qualitatively or quantitatively. The reaction results in a visual clumping of test solution when antigens and antibodies react. All right, I would definitely highlight this. An antigen is a substance that when introduced into an individual's body is recognized as foreign by an individual's immune system and causes a detectable reaction. Antibodies are specific defensive proteins produced when the antigen stimulates individual cells. So the primary function of antibody is body defenses is to combine with antigens, thus creating that clumping. So antigen, antibody. Remember that. So the antigen antibody reaction is, I would highlight that, agglutination tests are widely used to detect and measure the presence of antigen antibody reaction. So if it's positive, this is what you'll see. You'll see agglutination. So serologic tests, yes. Rapid plasma reagent, CAR test, and mono. Stick on dry dot. Okay. The RPR CAR test is a non-specific, easily performed screening test for syphilis. I would remember that. RPR CAR test is a non-specific, keyword, screening test. It's a screening test. It's not a confirmatory test. It's a screening test. So it detects it detects syphilis, and it detects a specific antigen called carbon particle cardiolipin. I remember that. So it detects reagent. Boom. So what antigen does RPR CAR test detect? It's reagent. So it's developed between 1 to 4 weeks. I haven't really seen that one on tests. Oh. So I've seen this one. So how it looks in the background when you on the actual test method, so it'll be a white background. So the way I just think about it, it's a whiteboard, and you have a black marker and you draw circles and you got clumps. I just remember it that way. So RPR CAR test, you'll see black clumps against a white background. How it's reported? It's either reactive or non-reactive. Don't get confused on that one, because I think it'll ask you the question and it'll say positive or negative. But remember, it's the way you report it out is reactive or non-reactive. Monospot. So it detects, it's in a word, mononucleosis. So yeah, so the monospot is a 2-minute test. It's very easy. I would remember this. The monospot test consists of specifically prepared stable sheep or horse erythrocyte antigen, dyed and guinea pig antigen on a disposable slide. So for this one, the test results, it's either positive or negative. Don't get that confused between the reporting results of RPR, which is reactive and non-reactive. Again, a positive result is indicated by agglutination or clumping, and a negative result is indicated by no glutination. Pretty simple. So fungus, they reproduce by spores that germinate into long filaments called hyphae. As they grow, they branch out, they develop into a mat of growth called the mycelium. Remember that. Oh, I've seen this one on the text. Reproduction is often asexual, usually by budding, as in yeast. Alright, I would highlight this. So how can you detect fungus or fungi? So the way you detect it is by this right here, KOH, potassium hydroxide preparation. I've definitely seen that on the exam. It talks about you can get scrapes of hair. A lot of times I use it more on like urine specimens to see if there is fungus in the urine, but you can remember that right here. Place skin, hair, nail scrapings from affected area on a glass slide and add 1 drop of 10% KOH, potassium hydroxide. How would you examine this? By high power field, which is your 40% of 40 times objective lens. So urinalysis. I've seen a couple questions on urinalysis. So there's three types of urine specimens. Again, some of these highlights are from different sources as well. So these things highlighted, you can go ahead and highlight, but I haven't personally seen these on the exam. All right, the following sections will cover the 3 types of urine specimens. So this is the random, which is whenever. This is the first morning, which is first thing in the morning, and 24 hours, so collection over a 24-hour period. So the random urine specimen is the most commonly received specimen because of the ease of collection and convenience. So in the lab, we mainly see random. They just come in at random time saying they got a urinalysis or something. That's the random. But because it's random, I would highlight that it is the least valid specimen, and patients may later be requested to collect additional specimen under more controlled conditions. So usually if it's random and something pops up positive, they'll redo it by, sometimes this can be like false positive, so you might want to do a cleanser method of collection. That's kind of what it's talking about. The first morning urine specimen is the first urine voided upon rising because it's the most concentrated usually. It is the ideal screening specimen because it is usually concentrated and more likely to reveal abnormalities. Yeah, so depending on what they see, they may order a 24-hour specimen. So 24-hour urine specimen, I'll remember the steps to this. I've seen this on an exam. Have patient empty bladder early in the morning, record time, discard this urine. So on the first day, you're going to discard that urine. After that, you're going to collect. Every time you want to go pee, you'll collect that. And then the following day, that will be included into the 24-hour. Definitely remember this. The normal daily urine volume for adult ranges from 600 to 2,000, averaging about 1,500. I would remember that. Yeah, diabetes is associated with increased urinary output, yeah. Preservatives, so the delay of decomposition of urine, use the following methods of preservation: hydrochloric acid. A lot of times when you have like mail-out specimens, you'll have certain tests that require this just so it can be more viable. Alright, routine urine examination. A routine urine acid includes the examination of physical characteristics, chemical characteristics, and microscopic structures in the sediment. A sample for urine should be at least 12 mLs in volume. So if you ever work in a hospital, they always ask what's the minimum. We want at least 12 mLs so we can do what we got to do with it. And of course, children probably might provide less. So children, it's preferred 10 to 15 ml is preferred. All right. So for the color, I would definitely know the abnormalities of it. So if you see the color red or red-brown, it's more likely the cause of presence of blood, right? That one's easy to remember. Yellow or brown is the presence of bile. Don't get these two mixed because they love to ask these two questions. I've seen the most. So yellow or brown, presence of bile. Olive green to brown black, phenols. I haven't seen that one as much. Dark orange, definitely seen this one, caused by peridium. Topical analgesic used in the treatment of urinary tract infections. So this one you'll see dark orange. Definitely know that. I've actually seen this one on test. It was like, how is the urine's appearance reported? And it'll be clear, hazy, slightly cloudy, cloudy, or turbid. And they threw like a random other kind of appearance on there, but definitely highlight that. So specific gravity, I've seen this on an exam almost every time I took it, I feel like. So specific gravity is defined at the density of a solution compared to an equal volume of distilled water. So here it is. The specific gravity varies directly with the amount of solids dissolved in the urine and normally ranges from 1.015 to 1.030. So remember that. 1.015 to 1.030. So, of course, a high fluid intake may reduce the specific gravity to below 1.010. That's because you have it's diluted urine, you have less material in there or particles. I really haven't seen this one on test. Oh, I've seen this. Specific gravity is measured with an index refractometer, but just remember that the refractometer is measured by. Hold up. All right. The specific gravity is measured using a refractometer. Oh, that's good thing to note. So there's a physical characteristics that it'll test. So the physical characteristic is color, appearance, and specific gravity. So that's in a physical. Chemical characteristics of urinalysis include the pH, protein, glucose, ketones, blood, bilirubin, urobilinogen, nitrite, leukocytes, and specific gravity depending on the test strip used. So just remember that. They would probably ask the question, what is in physical characteristics in a urinalysis, and they'll probably throw one of these, like protein, in there, and the other three will be color, appearance, and specific gravity. So they'll probably ask you which one is not measured by physical characteristics. In this case, it'll be these. And which one is not measured by chemical characteristics, which it'll be these: color, appearance, and specific gravity. So it is a colored reaction. The urine acid reagent strip. That's how we end up getting our values when you just dip the reagent strip in urine and just changes colors. I've seen this before. Improper technique can result in errors. Formed elements such as red and white blood cells sink to the bottom of the specimen and will be undetected in an unmixed specimen. So that's why if a specimen's been sitting, you want to mix it up before you end up testing it. So I would highlight that the amount of time needed for reactions to take place varies from an immediate reaction to 2 minutes. There's multiple things being tested. So example, like pH and protein, it ranges because some of the tests it's good from like 30 seconds, and I think the longest is white blood cell. So that one takes the longest to actually perform that color change or that reaction. So it's just remember this, from an immediate reaction to 2 minutes. So when should you report it out? So after the 2 minutes, right? All right, so I've seen this one on there. Specimens that have been refrigerated must be allowed to return to room temperature prior to reagent strip testing. Of course, you're not going to examine it right away, refrigerate it. On top of that, you want to mix it up before you actually end up testing it. So yeah, so microscopic examination of urine sediment is usually done at a 40x. I would remember that. So what's a normal range of leukocytes? In other words, leukocytes, white blood cells, right? 0 to 3 leukocytes. This is per textbook, okay? Just remember that. More than 3 cells per high-powered field may indicate disease somewhere in the urinary tract. So more than 3, possible infection. How are they reported? Estimated number per high-powered field. Yeah, yep. Red cells are usually not present in a normal urine. Of course, we went over this. White cells are larger than red cells. So if there's too many red blood cells in a specimen, if you're trying to view other things, you will drop 1 drop of 2% acetic acid added to the urine sediment, which in other words basically just ruptures the red blood cells, and it actually does not affect the white blood cells. I would remember that. I've seen that on test. Of course, it is not unusual to find epithelial cells. This is very common. It's probably one of the most common things you find in a urinalysis or urine specimen. Cast. I remember this. These urinary sediments are formed by coagulation of albuminous material in the kidneys. Oh, the sides of cast are parallel. I've seen that on the exam. The sides are parallel and the ends are usually rounded. So parallel and rounded, right? Cast in urine always indicates some kind of kidney disorder and should always be reported. Yeah, it's not very common to see these in urinalysis or urine specimen. Yep. So if casts are present in large numbers, the urine is almost sure to be positive for albumin. Yep. So critical results. So remember we talked about before, white blood cells count above 50,000 indicates an acute infection. Hemoglobin concentration below 7 indicates severe anemia that may require a transfusion. I don't know. I just remember that lucky 7. I mean, if you don't have a 7, you have something lower than that, then you lost all your money, you know. Glucose and ketones, both positive on the urine reagent strip, may indicate uncontrolled diabetes. I remember that. positive in glucose and ketones can indicate uncontrolled diabetes. The walk-in blood bank. So I've seen some questions on this as well. I actually seen it. They just would give you the acronym, and they would ask you what it actually stands for. So walk-in blood bank. That's what it stands for. A minimum file of 10% of certain ship companies required to be enrolled in walk-in blood bank. So I would remember that, highlight that. I've seen that in multiple exams, and it's good to know. So a minimum file of 10% of certain ships company is required to be enrolled in a walk-in blood bank. Oh, I will remember this. And this one's good to know. So laboratory results and readiness, right? So certain laboratory results are tracked for individual medical and operational readiness. This can include the G6PD, sickle cell, ABRH, which is your blood type, and DNA reference specimen. So these are usually collected and documented upon creation of treatment record at point of accession. I would remember that. And this concludes chapter 19 of the Core Manual Clinical Laboratory. You might notice throughout the video, I cut through a couple scenes just because it's a long chapter and I want to get down to nitty gritty. And I apologize ahead of time. If you hear sniffles, I told myself I've been trying to get this video out to you guys. So here it is. I'll be posting up more videos that I feel comfortable with personally. And thank you for tuning in.